teach physicians, nurses, therapists how to do hypnosis for pain control. It's a very underused tool. And what I'm hoping to accomplish today is, in the 40 minutes that I'm allotted, is to just give you an understanding of what hypnosis is, very briefly summarize the research, and then if we have time, I'm actually going to teach you a really cool method for using hypnosis for yourself, self-hypnosis, and you can even teach it to your patients. But what I hope to do is to give you some information that will make you enthusiastic about learning more. So, with that said, I hope this is not too loud. Is everybody okay with the volume of my voice? Good. So the learning objectives then are that after the completion, after listening to this lecture, I hope that you'll be able to define what hypnosis is. And of course, you can always look back at your handout that's included in the packet on the web app. You'll be able to just know that there's a lot of research that supports the designation of hypnosis as an evidence-based treatment for pain, that you'll be able to define pain in a way that's useful, that maybe you'll be able to think about going forward in your practices and actually take apart so you can explain it to patients in a way that's useful and understandable. You'll know at the end of this lecture why hypnosis is an ideal treatment tool. It's a tool, it's not the treatment. Something I want to make very clear is that I teach hypnosis to physicians, dentists, therapists, and so what hypnosis is, it's a tool for helping you to enhance your outcomes within your scope of practice, so that by learning how to do pain control hypnosis, if you're a neurologist, I wouldn't expect you to then go into helping somebody to recover from psychological or physical trauma. That's the role of a trained therapist. But as a neurologist, hypnosis, which is a language that reaches the unconscious mind, and also a way of communicating without inducing trance and a waking state in a way that really reaches the patient both consciously and unconsciously. By learning the language of hypnosis, you'll become much more effective at communicating with precision language to your patients. And there's probably nobody here who would disagree with how important that is. So, and even if you only have 10 minutes to see a patient, by learning hypnosis, what will happen is you'll begin to become more conscious about using yourself in your relationship with your patients at every level, no matter what the nature of the consult is. If we have time, I'd like to briefly explain this concept that I've developed of taming pain instead of fighting pain or trying to kill pain, because nobody and nothing wants to be killed. So, with that said, and there are resources that you can then look into if you're interested in learning more, which are available to you. Okay, so the first thing I want to present is an acronym that I didn't develop. I love acronyms. I didn't develop this acronym. It was developed by the late psychologist William Wester and his colleague Stuart Bassman back in the 80s. Will Wester was a former president of the American Society of Clinical Hypnosis and a great guy. And this acronym is a nice way of thinking about what the goals of using hypnosis for pain control would be, no matter what your discipline or specialty. And I want to make clear that from my point of view, the outcomes that we look to promote as clinicians who address pain control, that it's kind of an artificial distinction between the outcomes that we want to promote and the actual process of promoting them. So that when you learn how to speak precisely with patients and communicate with both their conscious mind, their critical analytic left brain, and their feeling brain, which was beautifully presented earlier by, I'm sorry,
Go Connie.
Yes. Anyway, the point is, we want to communicate with, and from my point of view, the two minds, the unconscious and the conscious. But we can also talk about that idea of the brain mind, the gut mind, but I also add the heart mind as well. So anyway, no more pain means noticing when and where you're comfortable. It means observing the control that you do have. It means motivating yourself to engage in healthy activities, opening your mind to new ideas and choices, learning to relax in a regular way that's effective for you. It doesn't matter whether it's yogic breathing or self-hypnosis or meditation, but everybody relates to a particular strategy or way of relaxing and calming the mind and the body. It's about evaluating your priorities and your time constraints, because in this hectic world, we're all pressured, and very often I myself find time is my enemy, because I have to make sure I'm at my offices on time, that I keep on time for treating my patients, don't run too far over in terms of the 45 minutes or an hour, depending on the office I'm working at, that are allotted for a patient appointment. Time is an issue. And so it's important, and that stress builds up when, you feel like you can't get it all done. And, so many of the chronic pain patients that I see, the ones especially that are working and are still functional and struggling with whether it's migraine headaches or severe back and leg pain or CRPS, which is reflex sympathetic dystrophy. The new term now is complex regional pain syndrome. When they struggle with time, it makes the stress worse, and stress worsens pain. So then the last part of that acronym, which spells pain, is teaching patients to practice positive thinking, to cancel negative thoughts, helping people to avoid unnecessary stress and conflict. In terms of what I do, I also use hypnosis, which being the language of the body and the mind, it's the language of imagination. And I help patients to imagine positive outcomes, to envision the objectives that they want, to begin to envision themselves being more comfortable and less controlled by pain. And lastly, negotiating support. So in any event, this No More Pain acronym is very helpful. So let me define hypnosis as a starting point. And, I think that we have a pretty good definition of hypnosis now that has been developed by different experts, psychologists, physicians that specialize in using hypnosis. And I'm going to present it. It's actually the definition that is on the website of the Society of Psychological Hypnosis, which is Division 30 of the American Psychological Association. It's pretty research-based. The definition is that hypnosis is a state of consciousness that involves focused attention, reduced peripheral awareness, and it's characterized by increased suggestibility. But I'd like to add to that, okay? And what I add to that, and what I'm adding is really not my idea. It's informed by people that are a lot brighter than me and have been pioneers, from my point of view, in the development of effective hypnosis techniques. I'm going to add this, that it's a state of consciousness involving selective focused attention, okay, selective, and the temporary suspension of critical thinking. And by doing that, it creates a state of increased responsivity to acceptable suggestions. Because nobody can be made to do what they don't really want to do, whether it's with hypnosis or anything else. And the hypnotic induction or trance induction is the procedure designed to create that state of consciousness. Hypnotizability, and this I think is a good definition of it, is basically an individual's ability to experience suggested alterations in the whole gamut of the things that we want to influence, right? Physiology, emotions, sensations, thoughts, and behavior. And then during hypnosis, if we can create a change that the patient experiences as wow, then we want to provide a suggestion, which is what we call a post-hypnotic suggestion, for that change to occur responsive to certain cues after the hypnotic state is ended, in that person's daily life. And then hypnotherapy is just simply the use of hypnosis for therapeutic purposes. And the therapeutic purposes that one would use hypnosis for as a clinician would be a function of, what your scope of practice is. Okay, so the research, since time is an issue here, the research will be quickly gone through, but the research shows that the efficacy of hypnosis, in this case, one group of researchers did a meta-analysis of over 85 controlled experimental trials, and they were experimental, they weren't clinical. And what they found that the efficacy of the hypnosis was influenced by hypnotic suggestibility and the use of direct analgesic suggestion. Analgesic meaning pain reducing or pain removing suggestions. But here's what's very interesting, that first of all, they conclude that lots of more clinical data is necessary to establish generalizability of their results from the experimental lab to clinical situations, chronic pain populations. And this is the study reference, Thompson et al., 2019. But this is the important point that I want to get across. Hypnotic suggestibility. Most people think that not everybody can be hypnotized. And I'm going to tell you this, everybody can be hypnotized. We all enter states that are like hypnosis every day without considering it hypnosis. States where we become absorbed, where we find ourselves just letting our mind drift. When we get absorbed in an interesting lecture, or when we get absorbed in a movie or a book or a piece of music, or even, I would argue, when we engage in what I would like to call mindful eating, when you're really, when you're not reading the paper, checking your emails, and, wolfing down your lunch or your breakfast or your dinner, when you're actually focusing on the food and the enjoyment of eating it. And so what I'm going to say to you is this, that if you learn how to do hypnosis for your practice and you get good at it, and you then use it appropriately with your patients, that you'll create hypnotic suggestibility, even if somebody on a formal test of hypnotizability scores in the low range, you'll be able to develop that rapport that is necessary to make that patient get absorbed in what it is that you're conversing about. And so the degree of the malleability of hypnotic suggestibility is really influenced by the clinical context, which comprises you and your patient and the environment in which you're seeing that patient. Rapport, your use of language, your skills, and of course the patient's motivation to get better. And the other thing is that analgesic suggestions, whether they're effective and focused and delivered verbally in a language that the patient can understand, is determined by the clinician's hypnotic language skills. And that's a function of learning how to do it and then practicing it. Okay, I'm going to have to rush through these different studies, but the findings from a large-scale review that was done by Dr. Gary Elkins Mark Jensen and Dave Patterson, that was published in the International Journal of Clinical and Experimental Hypnosis in 2007, showed that hypnotic interventions in clinical contexts consistently produce significant decreases in pain associated with a variety of chronic pain problems. But they, of course, called for more research being necessary, and they didn't address headache studies. So since this is a headache conference and a headache society, I want to address that. So there was a systematic review of the effectiveness of hypnosis for the management of migraines that was done by Flynn and published in that same journal in 2018. And the study demonstrated that hypnotherapy and relaxation techniques are effective in reducing short and long-term migraine activity in migraine sufferers. That's very encouraging. Flynn also tested an online hypnosis intervention in reducing migraine symptoms in a randomized control study. And the study demonstrated that hypnotic intervention delivered online was effective in reducing migraine symptoms. And there was significant reductions in a number of variables. First of all, that variable which has been shown to predict pain treatment outcomes, whether or not patients do something called catastrophize, that, they blow things up out of proportion and think the world is falling apart. It's the Chicken Little syndrome where the sky is falling, everything is lost, and constantly worrying, constantly being let down by everything. When pain catastrophizing is effectively treated and patients learn how to decatastrophize, pain treatment outcomes are dramatically improved. And cognitive therapy or cognitive behavioral therapy techniques are what are called for doing that. In addition, they administered, besides a pain catastrophizing scale, I think it was Sullivan's scale that was mentioned earlier. In addition, they administered a headache disability index, and they measured migraine frequency, duration, severity, and so forth. And what they found was that in this particular online intervention, there was a very significant reduction in headache disability index as measured by their instrument and in pain catastrophizing. That's a very important finding. But they didn't find significant between-group differences in frequency and severity of migraines, and that was because of, in my opinion, limitations in the nature of their study and their intervention. But there was a significant between-group difference in migraine duration, and I'll argue that the reason that there was is because patients who learned how to decatastrophize were able to abort the length, duration of their headache episodes effectively or more effectively because they had a tool at their disposal, which was decatastrophizing. Okay, so let me just skip to a study by Dr. Andrasik, who may still be here. I can't find him in the audience. Over there, yes. And it's on mindfulness in headache. And the research that Dr. Andrasik and his colleagues did that I found in my literature search shows that mindfulness is definitely a very promising intervention for improving headache therapy outcomes. And of course, Dr. Andrasik et al. Called for more research to be necessary. But what I found in my work, and I hope to present some tidbits of this in the remaining time, is that mindfulness is a very useful framework. I actually incorporated in the model of hypnosis that I use on a regular basis with patients. And I also, my most recent book is called Taming Chronic Pain, a mindful approach to bringing pain relief. And that's available for those who are interested on Amazon. So the word pain, it comes from the Latin pogana, which means pain, and also has the meanings of punishment, penalty, and penance that gave rise to the English word pain. And most people that suffer from chronic pain definitely think that their pain is punishing. The puzzle of pain is that pain severity doesn't in all the research that's shown, fit neatly into the medical model of a physical cause causing physical symptoms, because if you look at all the different studies that are reported, the amount and degree of pain and suffering is often completely disproportionate to the extent of tissue injury. And you find often that there's not a significant correlation. The research certainly shows this statistically, that there's not a significant correlation between static radiological images, MRIs, et cetera, and the dynamics of pain, because pain is a continually changing dynamic. And the same set of circumstances that, as a couple of previous presenters reported, can cause significant pain in one patient and very little in another. There's a famous study that was reported by a physician named Henry Beecher back in the 40s, who was a military doc and who had worked with wounded soldiers of the United States on the beachhead of Anzio in Italy back in World War II. And his retrospective study demonstrated that when he compared the extent of the injuries that these soldiers suffered in battle, which took them off the battlefield, and he compared the outcomes, how they dealt with it, to the way that civilians in the United States who were in the hospital or entering the hospital, the extent of their physical injuries, that the soldiers that were being taken off to the battlefield were like, they didn't have anywhere near the degree of upset and emotional overlay as did the civilians. And he implied or concluded that it was probably due to the fact that, of course, the pain had a different meaning for these soldiers, which was that it was their ticket to survive and to get away from the horror of the battlefield and to do so in an honorable way. Definition of pain. Well, I'm not going to take the valuable time that we have to unpack the definition that was first produced by a task force of the International Association for the Study of Pain. And the particular reference that I first got and I use is the one by Mirsky and Bogduk from 1994, because there's a better definition that I really like that I still use today. I want to share with you, that was published in '99 by a psychologist by the name of Howard Price. And this incorporates the best aspects of the International Association for the Study of Pain's definition. And it hits all the important points. So I'm going to just, verbally narrate this definition that is in the PowerPoint slide. And that is that pain is an unpleasant bodily experience that feels like something in the body has been or is being damaged or destroyed. That feels like a threat to the person or an interference with that person's ongoing functionality and health. And that's associated with negative emotions such as fear, anxiety, anger, and depression. So it hits all the important points. Now, I want to make a point right now to you guys, and this is the following. So I'm referring to my slide that I created to give you all the points. But when I talk to patients, I use this definition and I don't read anything because, I'm with the person I'm treating and I'm relating to that person. And I reference this very useful definition and I basically present it in a way that is designed to reach that particular patient. So how I present it to one patient is often very different from how I present it to another patient. But the point that's important to get across is that the mind and the body are connected. And that you can't, of course, you have real pain, because if you have a body and you feel pain, it's real. But the pain is also interpreted by your brain, which is part of your body. And so your brain determines how you experience the pain in your body, and it also sends messages to different parts of your body that affect your level of pain. So wouldn't it be nice if you could learn some techniques that would help you to use your brain to tame that pain in your body so that it's not as severe and is not as disruptive? And you got to be careful if you're talking to somebody that's on disability to say, so it's not as disabling. You got to be very careful with that. One of the things I've learned over the years from making lots of mistakes as a clinical psychologist specializing in pain is that you don't want to threaten a patient's livelihood. So you have to be very careful. So I very often said to patients in the pain clinic where I worked for 7.5 years that, would you like to be able to be more comfortable and free of pain when you're not at the doctor's office? And when you're not talking to a lawyer or your insurance company, and that when you do report your pain levels to your treating doctors, to your lawyer, or to the insurance claims adjuster, the pain can be very bad, but it's legit that the pain is very minimal when you need to be comfortable. Would that be all right with you? It's a very useful question to ask, and I've never had a patient that ever said, no, I don't want to be comfortable at home, and I reject that. I want to, that's lying. Lying? It's not lying, it's the truth, that pain varies in different situations, and there are a host of variables that affect that. So anyway, we know that pain is a signal that something wrong is wrong, and that acute pain is very important. It's an alarm. But when you have chronic pain, does the alarm have to be so loud? Does the alarm have to be on all the time? You already know that the pain is there. Can you perhaps learn to use the signals from your body, the pain signals that are telling you something, to reduce any extent of any injury that you might cause yourself? You got to be very careful of this too, because lots of patients with chronic pain, are afraid of doing anything that will make their pain worse or create new pain. So you have to tread lightly, and again, it's based on the patient and the history as to what you say. But the point is that nothing happens for no reason at all. So the pain that is chronic pain, chronic migraine sufferers have chronic, migraine pain, people with chronic low back pain and leg pain and other types of pain. The pain is persistent, it's often horrible, and all patients, if it's presented in a way that doesn't threaten their livelihood or their life, and I'm going to explain that in a minute, will say yes to wanting to learn how to lower the volume, the intensity, the frequency, or the duration of that alarm that their body has been constantly giving them, which, is not very pleasant. It's very unpleasant, right? So this is the thing I want to make a point of. I think it's on this slide. We should avoid, and lots of well-meaning docs have told patients that they need to learn to live with their pain. And to my point of view, and from research that I can share with you, if you personally communicate with me, telling a patient that you need to learn to live with your pain is toxic. And take a moment right now, just think about that statement, okay? And then I'll tell you why. Take 15 seconds. Think about the statement. You need to learn to live with that pain, what it does to you. If you have chronic pain and you hear somebody in authority that you respect or are afraid of in a highly anxious moment telling you need to learn to live with that pain, what it tells your unconscious feeling mind is that if you don't have the pain, you're going to die, you're going to be dead. Because the unconscious mind is very literal and very concrete. It's illogical. Think about it. You need to learn to live with that pain. Well, if you're not living anymore, you won't have pain. And many patients with persistent pain syndromes that are haven't gotten well, they have this underlying fear that has to be addressed, and it's best addressed by a therapist who is trained to use pain control hypnosis. But from the standpoint of a physician in the office, you can say to the patient something slightly different, and the unconscious mind gets a different message. And what I would say to a patient if they said, oh, my doc's told me I got a lot to live with the pain, I say to the patient, I understand. They meant well. How about if we work together to teach you how to live with less pain? Less pain. That's all. That's a very important point. Pain's emotional triads of ADA, anxiety, depression, and anger. I would add alienation, and that creates impatience. Many chronic pain patients want immediate relief, and they're impatient. They've had a lot of disappointments. Okay, we're going to skip through this. Hypnosis is an ideal treatment or treatment tool for working with people with persistent pain syndromes to enhance treatment outcomes within your scope of practice. And one of the reasons why hypnosis is so useful, if it's done skillfully, is that you can't try to enter a hypnotic state. You just either do or you don't. Hypnosis is effortless. In order to be hypnotized, in order to enter a hypnotic state, that's selective, focused attention, the temporary suspension of critical thinking, okay, and to become increasingly responsive to acceptable suggestions, you have to be comfortable. You have to let go, and you have to not be anxious. You have to empty your bladder before the hypnosis session. And you also, okay, have to not be afraid. So the hypnosis pre-talk, if you're going to do formal hypnosis, has to include a little explanation that reduces fears and misconceptions of what hypnosis is. Okay? Now, I'm not going to get into the opioid business. All I want to say, though, is that people, and I see so many chronic pain patients, and so many of them are dependent on narcotics, on opioids. And one of the things that I discuss with patients, because I do believe that it is important to help someone once you develop rapport to wean off the opioids. One of the things that I discuss is the fact that when your body becomes dependent on the narcotics, your body shuts down the internal factories that naturally produce internal pain-killing chemicals, hormones, neurotransmitters, and so forth. And so you need more and more of the narcotic, the opioid, in order to feel the same level of relief, because your body progressively shuts down those factories and just depends totally on the external ingestion of those chemicals, those opioids. And eventually, it gets to a point where it can get really bad, because I've seen so many patients that need surgery, and they are not responsive to the anesthetics that are used by the anesthesiologist because of the tolerance that they built up to the opioids that they've been taking routinely. All right, let's see here. The benefits of mindfulness-based pain control are that you can teach someone to not be constantly trying to avoid feeling pain. And you can teach somebody to reframe his or her mindset so that they're willing to actually experience the pain without catastrophizing. And that builds pain tolerance, it counters avoidance, and it forms a very important basis for helping a patient to reframe or change their viewpoints about how their past affects their present, and to let go of resentments. Resentments is a big problem with people that have persistent pain. If you think about the population of patients that you work with. Well, I did want to mention tame. I really like the concept of taming pain. I got the concept actually from an old fairy tale book that was published in 43 called The Little Prince by Antoine de Saint-Exupéry. Raise your hands if you're familiar with that book, if you've looked at it. It's a wonderful little book. And to basically synopsize it, the fox teaches the little prince that if the little prince wants the fox as a playmate and a companion in that isolated desert, that first the little prince has to tame the fox. And he explains what it means to tame the fox. And he says, it means to gradually build a relationship, to put time into the relationship, to establish a tie, and to observe some rituals, which are the types of rituals that we all naturally, need to observe if we want to make a friend. Like, when you meet somebody, there are certain rituals, you're either appropriate or not appropriate, and how you do that, and then inviting somebody to sit down, have a drink, have coffee, whatever. And that's what we're talking about. And then from a long-term basis, essentially observing rituals that allow you to develop a closer connection. Okay, we're running out of time, unfortunately, and what I last want to do is say this, that if you're interested in learning more about my framework for addressing the problem of pain, that you can do that. My website, bruceimer.com, is chock full of a lot of information. And also, I teach intensive 2-day workshops on pain control hypnosis. And you can find out more on my website, bruceimer.com. But basically, the framework that I teach is that first, you have to assess what to target. And there's something called the basic ID, which essentially encompasses all the important dimensions of psychological, physical, and behavioral and social functioning. And then you assess the problem along the basic ID. You then present a framework, which I call the AWARE model, to the patient for taming pain. You present it based on what you've learned from the basic ID assessment. You present that framework to get the patient motivated to then work with you and basically to teach the patient to become free of pain. Okay, and one of the things that and the interventions that I use, or the strategies, I call the 8 Ds of pain control. And you can actually learn these and teach these to patients with or without formal hypnotic inductions, okay? The 8 Ds of pain control. And last but not least, because we're out of time, is ancient wisdom. I love this. It is this: when pain knocks on the door, wise ones breathe deep and say, come in, sit down with me, and don't leave until you've taught me what I need to know. And now, since time is running out for this workshop, I'm going to teach you that pain control hypnosis technique in less than a minute. May I have a minute? Okay, thank you. So here it is. Everybody get comfortable and settle in. If you'd like to participate, sit and relax. Okay, and place one hand or the other on your abdomen. Great, thank you. And now, just simply observe as your hand moves up and down as you breathe. And you can look at your hand. You can look at the ring on your finger or your knuckle or your thumb and watch that hand move up and down as you breathe. And then observe that as you continue to watch that hand, that your breathing changes all by itself. Now you can assist or not by taking a slow, deep breath and then letting it out slowly. Or you can just simply watch your breathing change and notice how it changes. That's right. That's right. Now, as you watch your hand moving up and down as you breathe, that's right. Perhaps you'd like to envision a healing quality moving from the palm of your hand into your stomach. Perhaps warmth or coolness or any quality that that you wish to have to help you to feel more comfortable. That's right. And that quality, let it travel. Let it flow through your body to those parts of your body that need that comforting sensation of relief the most. And if you'd like, you can close your eye and relax even more. That's right. And continue to feel your hand moving with your breath, sending that comforting quality into your body. It feels really good, doesn't it? Just nod your head if it does. That's right. And now we do need to emerge from this pleasant little exercise. So I'm going to just count to 3. And just with my count, just bring yourself back up. 1, 2. And when you open your eyes at the count of 3, if your eyes were closed, just be wide awake and alert and feel a little bit more relaxed than you were earlier. And 3. Open your eyes and just notice how much better you feel. Raise your hands if you feel a little bit better, a little bit more relaxed, maybe energized, and ready to learn more from the presenters that are going to come after me. And that was great. So thank you for participating in this exercise. I really appreciate it. And time is up. And if you want to learn more, you know where you can go. And thanks for listening.